say thank you for having me because I feel incredibly honoured to be here today. I love you guys. I love GPs. You're a pretty special mob. You really are. My sister-in-law is a GP, and I think she's one of the most extraordinary people I know because of what she does day in, day out. She's not sure who is going to walk through her practice doors, what sort of issues they're going to have for her, but whenever they leave feeling better. Maybe not suddenly better, but better within themselves. And I think as GPs, that is what you do. I love my GP. We are very much, she's a family affair for us. She looks after my husband. She looks after my two daughters, who are 6 and 8. And she also looks after my mum. Mum goes and sees her weekly. She also now looks after my sister, her husband, her kids. So very much I see Kathleen, I call her Kathleen, almost an extended member of my family because she knows so much about us. And I think that is what each and every one of you do. It's not just in comes someone, out you go. You form a very special, unique relationship with your patients. And frankly, I don't think you earn enough money. I really don't. I also think about the GP that I saw when I was a little girl. He was a beautiful man called Dr. Barry Lum, and I live in Sydney, and he saw me as a little girl, 4-year-old girl, up until when I left Sydney to go and study at university. And he was such a beautiful man that years after he retired, whenever I'd see him in the street, all he had to do was smile at me, and I sort of instantly felt a little bit better. My mum likes to remind me of a story of when I was about 4, I was starting school. We started school a bit earlier in those days. And I was a very anxious, nervous little girl. And I had this habit of, I kept going to the toilet when I was at school. I went numerous times until eventually Mum thought, oh, we better go and get this investigated. So I went to go and see Dr. Lum, and he prescribed me some very special little tablets. And he said to me, if you take these, you won't need to be going to the toilet anymore. And they were magic. They were a placebo, but they were just wonderful. So I share that story in that there is so much that you have to grapple with daily to think, well, how can I solve this particular problem? I can't just go down the standard path. What else might be something that will work in this case? For me, the placebo worked beautifully. As a grown-up, though, unfortunately, placebos don't work for me so much anymore. I have been very open in the past, and I will continue to be very open about my own experience with depression, with postnatal depression. I don't have to tell you of how widespread the issue of mental illness is in our community. Each and every one of you is at the coalface of that people come in, present themselves with a number of mental health concerns. And again, I take my hat off to all of you because that is not an easy thing to grapple with, to diagnose all the different sorts of conditions and to make sure that patients are getting the necessary care. But you are doing that, and I thank you for that. What I thought I'd do is just explain in the little time I have a little about my own story. And it's a story that I'm sure is a story that many of your patients could say, hey, that is my story. It might in fact be your own story as well. I had issues with infertility. I remember going to see Kathleen, my wonderful GP, about that. She was very caring and helped lead me in the right direction to a terrific IVF specialist. I was lucky enough to go through IVF, and it worked. I had this beautiful baby, Allegra. She's now 8. And I felt like life, or I thought life couldn't be better. I now had my much longed for baby, my beautiful husband. Life now would begin for me. What did I have to be miserable about? Because early on, probably a week after Allegra was born, I started to very much feel that what I was experiencing, the sorts of emotions, feelings I was having, was not normal for a new mum. Yes, I was sleep deprived, I was exhausted, but I started to feel incredibly anxious. I felt like I was having panic attacks. I was having panic attacks. I'd never had a panic attack before. And I started to feel more and more out of control. It was as if there was a pane of glass between me and the rest of the world. And it didn't matter how much I tried, I couldn't break that pane of glass. At the same time, I felt under enormous pressure to put on a brave face. So if anyone would see me in the street pushing my brand new, beautiful baby in her pram, they would look at me and say, "Oh, look at that mum, she knows what she's doing, she has it all together." But on the inside, I felt anything but that. I felt like I was losing my mind. And that is a terrifying place to be, especially for someone who has always been in control. I'm someone who, in my professional life, had worked very hard to think, okay, if I do this and this and this, I will get this outcome. Here I was now, though, thinking, I don't know what I'm doing. I feel at sea. Whatever I'm trying is not working. I can't breastfeed. Who knew that nipples could bleed until I began to breastfeed? No one ever told me that. And it was a really awful, terrible place to be. At the same time, I was also very terrified that perhaps what was happening to me now was what had happened to my mother. Because my mum's got bipolar disorder. So I'd grown up with a mum with a very serious mental illness, and I'd seen the impact that her illness had had on her life, the incredible struggles that she had had at various times, and I was terrified that was now going to happen to me. And thank God for my GP. Thank God for my then psychiatrist, who my GP referred me to, who got me through. Because if I hadn't have done that, if I hadn't have put my hand up and said, I need help, I don't know where I'd be today. And I know it takes enormous bravery and courage for people to walk through your doors and say, I need help. I don't know what I'm doing. I need help. Because from the outside, a lot of us are very good at putting on our mask, our coping mask. Oh, everything's wonderful. Couldn't be better. I remember going along to my first ever mother's group, something that I had been looking forward to doing, and thinking, I was really looking forward to sharing experiences with other women. I was late to the meeting because I couldn't get Allegra in the baby capsule into the car, and I thought, I've been able to interview prime ministers, do all of this stuff in my professional life, why can't I work out a baby capsule? But anyway, I got to the mothers group, and I was late. Everyone in the group was happy. They were all breastfeeding, and my daughter, she had a dummy, and I remember sitting down, and the midwife said to me, "You're not using that, are you? That's terrible." And so even before I sat down, I thought, oh no, I am a failure. And the conversation began. "Isn't this the best time of your life? Doesn't it just get better and better? Oh, breastfeeding is a breeze. I love it. It's almost like having an orgasm." And I'm thinking, oh my goodness. And then my baby sleeps all night. And of course, now I know that that is a lie. But at the time, I was so vulnerable. I didn't know what I was doing. I was in this scary new world. I was madly in love with my daughter, but I had never felt so out of control and so out of my depth. And I was longing for an honest conversation in that mothers group. And not surprisingly, I never went back to that mothers group. But when I think about that group now, there would have been other women in that room who felt exactly like me, who felt like they weren't coping, who were also probably too having struggles with breastfeeding, whose babies were not sleeping, but because none of us had the courage to say, you know what, this is hard. I love my baby, but I hate this. I don't know what I'm doing. Because none of us had the courage to initially do that, it didn't then give anyone else permission to also say, you know what, yes, this is difficult for me too, but I'm finding this helps or that helps. And that's why I talk very openly about my own personal experience, because I think it's not just my experience. You know the statistics, you know the figures. 1 in 7 women will have postnatal depression. And it's a terrible, awful place to be. But if you put your hand up, if you say, I need help, if people walk through your doors, your practice doors, and say, help me, you're able to do that. And I know, because I put my hand up for help, because I got the medication and the care and the love that I needed, that I got better. And I realised that I wasn't a failure, I wasn't a bad mum, I just had an illness and I just needed some help to get better. And I think very much that is what each and every one of you are doing in your day-to-day roles. You are giving people the most extraordinary help, and perhaps you realise it, maybe you don't, but from the other side, from a patient's side, I want to say thank you, because it's because of your care, attention, and persistence that helped me through. And I know that for many of you, that helps your patients. I think about my mum who has bipolar. There are so many times when she's well, but there are many other awful times when she's not well. Our beautiful GP continues to look after Mum. Mum will visit her weekly for a bit of a catch-up, checking out how her health is going. And I know for my mum, that is it's a lifesaver. And it's also a lifesaver for me as her daughter, because I feel so responsible for her. But I'm not a doctor. I don't know how different medications are going to interact. I don't know what I need to do to keep her healthy and fit, whereas her GP does. So again, I thank you. I thank you on behalf of my mum. I also thank you on behalf of my daughters, my beautiful Allegra, who, as I said, is now 8, and Giselle. They, from little weenie age, as you know, as a new mum, when you hand your babies over for those injections that you give, oh my goodness, I know you do it daily, but as a mother, you're just there thinking, I don't know, how can I possibly, allow my baby to have this needle? They're crying, but you handle these little ones with such care and compassion. So thank you. I also know that now my daughters, that they're not frightened of going to the GP because there are jelly beans. I hope that you all have jelly beans or snakes or whatever it is, but a little bit of bribery is always very useful. And I must say, I don't mind the odd jelly bean as well. And the other thing too that I thank you for is how you see us through our lives. I've said a little bit about how I remember as a little girl, as a 4-year-old, my GP helping me. I'm 40, what am I now? 45, and my GP is still helping me and guiding me, helping my husband, helping my daughters. And I think that's why, as GPs, you are so special, because it's not just about an illness or a medication or some fandangled new gizmo that operates on someone's stomach and it's all terrific. It's the whole person that you are seeing. And I think, well, not I think, I know, it takes a very special kind of doctor to do that and to be a GP. I'm really hoping that the health minister is about to walk in. No sign of her, because I want to say we need to be paying you more. How many more times can I say that? We need to be paying you more. And again, I think about my personal experience having got through postnatal depression and now my daily life. I mean, I still take antidepressants. It's something that I don't feel ashamed to tell people because, again, I think there is still far too much stigma that surrounds mental health issues and also far too much stigma that surrounds people taking medication for it. As you would know, most people do not have a problem with taking tablets to lower their blood pressure, cholesterol, insulin for their diabetes, all those sorts of things. But whenever it seems to come down to medication for mental health issues, we can't talk about that. But I have no problems talking about it. I recall actually when I went to see my psychiatrist in those early days after my GP referred me to see her, and I got in to see her very quickly, which was wonderful, that during that first meeting, I sat down and I put on my best lovely lipstick, a dress a little bit like this, sat down, and she said to me, "You can stop pretending now." And because she could see through my mask, she knew that I had to drop this mask, that everything was okay. We spoke a lot that first appointment about how I was feeling, the sorts of obsessive, frightening thoughts that I was having that were going through my mind. And she said to me, "But that's normal." And I said, "Normal? I feel like I am a crazy woman. I feel like I'm losing my mind," because I was terrified to confess to her what I was feeling, because I thought my daughter would be taken from me. I thought I'd be sent to hospital. But my doctor said to me, "No, what you are feeling is normal. It is normal for someone who has postnatal depression." And I needed to hear those words. A little bit of weight came off my shoulders. We then spoke more about the sort of treatment that I would need. And she said, "Of course, I want you to come and see me twice a week to start with. And then there is medication." And I said, "Great, let's get started on the medication." And she sort of laughed at me and she said, I've never had a patient been so willing to take medication. And, normally I have to convince my patients of the benefits. But I said to her, I had seen what medication had done for my mum's life, that it had given her a quality of life that she could not have had without her medication. So I wasn't afraid to take my tablets. I knew that would help me enormously. So I filled out the script that afternoon, was eager to get started. And about 2.5 weeks after I'd begun my antidepressants, I'll never forget, I was standing in my front lawn. Allegra was sound asleep. She just had her lunchtime feed and she was sleeping. And I could suddenly smell the gardenias again. That beautiful, sweet, fragrant smell. And that was something that I hadn't smelt in such a long time. And for me, that was such a wonderful moment because I started to feel like I was coming back to myself. I knew it wasn't like I'm better, but there was this lovely stirring inside of me that I could exhale a little, and there was this sense of hope returning. And I know that's what you do each day in your practice. You give people hope. You give people a sense that there is a way through. And I'm such a believer in hope because if we don't have that, we have nothing. And you can never underestimate, I think, the value of hope and that very, very special human connection that you all have. I just want to thank you all so much for having me, and I want to thank you for your contribution.